Order. End of question time. Ministerial statements. Minister for Health.
Mr. Deputy Speaker, sir, today my fellow co-chairs of the Multi-Ministry Task Force, the MTF, Minister Gan Kim Yong and Minister Lawrence Wong, and I will be delivering ministerial statements to update members on the COVID-19 situation in Singapore. Our ministerial statements will address oral questions 1 to 5 and 26 to 28, and written questions 28, 29, 31 to 33 of today's order paper. It will cover questions on the KTV and Jurong Fishery Port clusters, our COVID-19 vaccination program, and our plans to transit to live normally with COVID-19. Mr. Murali Pillay, Associate Professor James Lim, Mr. Darrell David, Mr. Xie Yao Chen, Mr. Yip Hon Wing, Mr. Seah Kim Peng, Ms. Raisa Khan, and Mr. Sito Yipin have filed oral and written questions scheduled for future sittings on these issues. As today's ministerial statements would address those questions, Mr. Deputy Speaker, sir, I would like to invite these members to seek clarification should they have on these issues after the ministerial statements. And should their queries be sufficiently addressed, it may not be necessary for them to proceed with their PQs for future sittings. With that, let me start. On Monday, 12 July 21st, MOH detected several COVID-19 positive cases amongst individuals who frequented KTV, bars, and lounges. These individuals included patrons of the bars and hostesses who worked in the lounges. These activities were considered very high risk and had been disallowed since the beginning of the pandemic. The cluster grew rapidly, and MOH moved in quickly to isolate infected persons. We identified rings of contacts and tested them for COVID-19. We ordered a 2-week suspension of operations in all pivoted nightlife establishments from 16 July to 30th July. The pivoted nightlife establishments cannot resume operations until they pass inspections to ensure that safe management measure protocols are in place and they have received written approval. Mr. Xie Yao Chen asked if we would consider making the individuals in the KTV cluster pay for their COVID-19 medical expenses in full. We are all upset by the irresponsible behavior of the individuals involved in this KTV cluster. But we still have a public responsibility to ensure that everyone receives the medical care that they need. We also do not want individuals, especially those who are infected, to avoid getting tested and treated or hide where they have been from contact tracers because they are afraid of getting penalized. And this will make it harder to contain the spread and would cost us more in the long run. We were on the path towards progressive opening, and the KTV cluster was a major unexpected bump on the road. The MTF deliberated on the matter, took in advice from MOH experts, and came to the conclusion that given our extensive tracing and testing efforts and our population vaccination rate for 2 doses were approaching 50% at that time, on balance, we felt that the cluster ought not significantly change our plans to open up. Hence, on 16 July, the MTF announced our decision to maintain our then current safe management posture. We made some adjustments to the rules for eating in restaurants. We call it the 2-5 rule. 2 if you are unvaccinated, 5 you can dine together, provided everyone is vaccinated, is fully vaccinated. Based on how the cluster has developed, we still believe that was the correct call. As of 25th July 2021, that means yesterday, end of yesterday, the KTV cluster has a total of 237 infected persons. For the past 3 days, the daily increase in infection for the cluster was 6, 5, and 5 respectively. So it is coming under control. But unfortunately, things got derailed due to a larger and more troublesome cluster. And this is the Jurong Fishery Port cluster. On the evening of Friday, 16 July 2021, we started to detect multiple infections at the Jurong Fishery Port, as well as in Hong Lim Market. This involved fishmongers, their assistants, going about an honest living, collecting fishes at the fishery port, but unwittingly getting infected and then transmitting to more people in the markets and communities where they ply their trade. MOH, with the help of NEA, took immediate steps to prevent further spread by stopping the fishmongers and their assistants from setting up stores on Sunday, 18th July 2021. It was very tough to tell them you can't set up stores. We then issued health risk warnings, which required them to undergo PCR tests and isolate themselves until they get a negative result. Of the 1,548 tested, 43 were found to be COVID-19 positive. The numbers are a bit different from what I reported earlier as we clean up the numbers. This indicated that significant community transmission had most likely already silently occurred in the days before 18th July 2021 Sunday. See, markets are frequented by wide segments of the public, particularly seniors, of whom 1/4 are still not fully vaccinated. The risk of infections rising uncontrollably could not be ruled out. These infections could potentially result in more cases of severe illnesses or even deaths among our vulnerable senior population. Hence, the MTF decided to preemptively dial back to Phase 2 heightened alert. This came into effect on 22nd July 2021. We did this to buy ourselves time, precious time, to get more of our population vaccinated, so that we can continue on our path towards living with COVID-19 safely. The preliminary phylogenetic findings suggest that while the KTV and Jurong Fishery Port clusters were all driven by the Delta variant, it is distinct from the Delta variant that infected Tan Tock Seng Hospital and the Changi Airport clusters. The recent clusters have a Delta strain that is more closely related to what we detected in imported cases from our immediate region. However, there are also slight genetic differences between the strains in the two clusters, suggesting that there were multiple introduction points. As of July 25th, 2021, the Jurong Fishery Port has a total of 792 cases. It is still growing, but now at a slower rate. The daily infection numbers over the last 3 days were 79, 79, and 46, respectively. Overall, we have seen a high number of daily cases at over 100 for the past several days. But the situation is stabilizing, with daily infections trending down. Percentage of cases isolated or quarantined before turning COVID-19 positive is something we watch closely, and it is on an upward trend, which is good. That means when the person is started to be detected as positive, he's already quarantined and isolated. On 19th July, that's when the cluster first broke out, we had a total of 163 cases, and only 27% were isolated before detection. Lately, this hovers around 40%. Today, we should have more than half of our cases already isolated. If we can keep raising that percentage through tracing and testing, we can progressively suppress this wave of transmission. But our objective is not to stop transmission completely. That is no longer possible given how transmissible the Delta variant is, and as we open up and people circulate more. So the only possible way now to eradicate infections is to go into a hard circuit breaker for at least a month, probably two. But we don't want to be locked up. Further, even if we do lock ourselves up, when the CB ends and we open up, cases will rise again. So eradication is therefore not possible nor sustainable. We must instead find ways to live with this virus safely. Several members, namely Mr. Yip Hong Wing, Associate Professor James Lim, Ms. Raisa Khan, were interested to find out more about our transition plans to live with COVID-19 as an endemic disease. Vaccinations are key to this transition, and the national program is progressing well. As of end of yesterday, 25th July 2021, 54% of our population has received 2 doses of the mRNA vaccines. And our population vaccination rate is going up by about 1 percentage point a day. So by National Day, almost 70% will have received 2 doses. By early September, it should be almost 80% having received 2 doses of mRNA vaccines. And this means Singapore by then will have one of the highest vaccination rates in the world. It puts us in a strong position to transit to a COVID-resilient society. Our main worry is that our seniors, especially those 70 and above, are not sufficiently vaccinated. Today, just over 70% of them have received 2 doses of the vaccines. Ms. Ting Pei Ling asked for an update on the home vaccination scheme. We have launched 9 home vaccination teams so far. As of 23rd of July, 734 seniors have received vaccinations under that program. Further, more seniors are coming forward to our vaccination centers and also our mobile vaccination teams. We have been seeing about 500 seniors coming forward on a daily basis to receive their first doses for the past a few weeks. But for the past few days, that number has doubled to over 1,000 every day now. How did that come about? It's good news, but it may be due to heightened awareness as a result of more community transmission, lifting of rules that had previously deferred their vaccinations for those with medical conditions, and also our very intensive outreach efforts. For example, our mobile teams have gone all the way to Pulau Ubin to vaccinate seniors who are living there. We know of GPs who called up their clients, the seniors, persuaded them, go for vaccinations, and then open up their clinics for them to sit in the clinic the whole day so that they feel assured that if they feel unwell, help is always nearby. Help from someone they trust, their GPs. Mr. Deputy Speaker, sir, this is a measure of the kind of society we are. We are making such an extraordinary effort with our seniors because we are not prepared to accept the high fatality rates amongst the elderly that other countries had or are still experiencing. As a result of all these efforts, 77% of our seniors, 70 and above, have now received their first doses. Within a month or so, they should all have received their second doses. And after that, another 14 days, they should all be strongly protected against COVID-19. Even at our current rate of vaccination, 54% or so, 2 doses, the preliminary evidence is that it has been effective in reducing the incidence of severe illnesses and deaths. Mr. Deputy Speaker, sir, may I show a chart on screen, please?
Yes, please do.
Thank you. Top line is blue line is infection. Bottom line, orange, is number with severe illnesses requiring oxygen supplementation or ICU. As members can see, while daily infections have gone up sharply over the past couple of weeks, the number of patients with severe illnesses who require oxygen supplementation or in ICU remains relatively low. There's a slight uptick, but relatively suppressed. Currently, all of these patients with severe illnesses are either unvaccinated or partially vaccinated. But we are watching this closely because there is a time lag of 1-2 weeks between infection and the onset of severe illnesses. For now, it would appear that we have successfully weakened the link between infections and severe illnesses. While we are making good progress in vaccinating our people, we acknowledge that the recent reversion to phase 2 heightened alert has caused some confusion amongst members of the public. They are asking, are we still committed, or is the MTF still committed to the path towards normalcy and living with COVID-19? The answer is a definite yes. For that is the only way for Singaporeans to regain our lives and livelihoods, for Singapore to reconnect with the world again, for our young to look into the future with hope. Some countries like the UK have declared a Freedom Day recently, where all social restrictions are lifted all at once. Others, like Israel and Netherlands, opened up and saw sharp increases in infections and hospitalization and have to dial back very quickly. Ours will be a controlled opening. We are not going to do a big bang, because predictably things will then blow up. The MTF has been developing a roadmap comprising packages of measures to be implemented step by step over the next few months, and with every step ensure that opening up is safe for the community. But even as we do so, we must bear in mind that until we reach a sufficiently high vaccination rate, especially amongst our senior, we will continue to be vulnerable to unexpected setbacks, just like what we are going through now. A high rate of vaccination will provide us with a more solid and stable base as we proceed on this journey. The higher the vaccination rate, the more solid the ground we walk on. So in a way, this is the most peculiar period of our transition, where we are clear about our mission, our will is firm, we have a broad plan, but we don't have enough antibodies in all of us to ensure that we can follow through our plans without a hitch. But let us not underestimate the progress we have made. The roadmap is in fact being implemented as we speak. Our attention often is on the SMMs, the safe management measures, such as whether we can eat in restaurants. But there are at least 3 other important aspects, namely, 1, restoring economic and social activities, including connecting with the outside world. 2, remodeling COVID-19 healthcare protocols. And 3, shifting our collective psychology, which I feel is probably the hardest. Minister Gan will speak about restoring economic activities, while Minister Lawrence Wong will speak more about enabling more social activities. Let me talk about healthcare protocols and our collective psychology. As we learn to live with COVID-19, our healthcare protocols must be remodeled. If COVID-19 is indeed endemic, having 200 or more cases may not be an unusual thing at all. During an influenza season, our daily infection rates can go up to as high as 1,000 a day. Imagine we treat influenza like we treat COVID-19. This is what will happen. We will put everyone suspected of influenza infections through PCR tests, and then long isolated stays in hospitals. And then everyone they come into contact with will be quarantined. 1,000 cases a day. This will disrupt the lives of many people. Further, hospital beds will all be filled, and many other patients who are sicker will be turned away. The healthcare system will not be able to cope, and that is clearly not the way to deal with an endemic disease. So if we want to live with COVID as an endemic disease, we cannot carry on with the current healthcare protocols. They need to shift closer to how we treat influenza today, without extensive contact tracing and quarantine in dedicated facilities, and hospitalizing only those who are very ill. But that can only happen when the likelihood of developing very serious or life-threatening disease as a result of COVID-19 infection has been significantly reduced by effective vaccination of our population, especially amongst the vulnerable. With our current rate of vaccinations, we have started to take the first transition step to remodel our healthcare protocols. As of last week, we made the following changes. First, greater use of community care facilities instead of hospitals. Vaccinated individuals aged between 45 and 59 who tested positive for COVID-19 and show no or mild symptoms can be directly admitted to community care facilities instead of going first to hospitals. So these community care facilities currently is, for example, is NTUC resorts, as well as CSC Loyang. This was already the practice for all cases aged between 17 to 45 years, but we are now expanding the protocol to people up to 59 years old. And with this change, we expect up to 60% of infected cases to recover in community care facilities instead of in acute care hospitals. Meanwhile, we will plan for the next step, because this is just the first step. We'll plan for the next one, where perhaps 80% can be admitted to community care facilities, and some can even start to recover at home. Second change, we have shortened the length of stay in hospitals and community care facilities. Our tests have shown that the viral load in infected persons who are fully vaccinated falls very rapidly to a very low level after 9 days. Previously, most people generally were discharged only after 21 days. We are now discharging fully vaccinated persons after 14 days from the onset of illnesses, with a 7-day leave of absence in addition, so long as their tests show that they are COVID negative or have very low viral loads. We are reviewing our policy to allow fully vaccinated patients to be discharged even earlier and to complete the rest of the isolation period at home if their home environment is suitable. Third change is the greater use of home quarantine. For fully vaccinated persons, they can now serve their quarantine at home instead of a dedicated government facility, provided that their home is suitable for isolation. We expect up to 40% of persons under quarantine can serve their quarantine at home, and this will go beyond 50% in the coming few weeks as more people get vaccinated. These are amongst the first steps that we will take in the healthcare transition. In the meantime, what we are experiencing in this current wave of transmission is also valuable because we are also witnessing a palpable shift in our collective psychology. The first, I think, is a shift away from always focusing on infection numbers. We used to get a shock when we see high daily numbers because this will mean a week or two from then, we will see more severe illnesses and deaths. However, in recent days, that mental link is starting to be broken, as we know that with vaccinations, high infection numbers need not necessarily mean more sickness and deaths. Many people are now rightfully focusing on the number of people with severe illnesses. As of today, despite the higher infection cases over the past few days, that number is 14 and does not threaten our hospital capacity. Many friends, including members of this House, have been texting me, asking me, Why don't we publish the number of people with severe illnesses so that we know that vaccination works? Actually, the media have been publishing these numbers every day for quite a while now. But our attention is always on the vaccination, on the infection numbers. But it is good that the attention is now shifting. I wouldn't say there's a huge psychological shift, but I think the shift is starting to happen. A second shift is a greater acceptance of differentiated safe management measures between those who are vaccinated and those who are not. There have been many calls to do this. Mr. Xie Yao-chen has also asked about this. This is something which the MTF has always intended to do, and that was why we decided on the 2-5 rule for restaurants when the KTV cluster broke out. But it was scuttled with our reversion to phase 2 heightened alert. When our whole society is very highly vaccinated and we have transitioned to living with COVID-19, we should make very little differentiation between the vaccinated and the unvaccinated. But during this period of transition, when we are still building up our resilience, differentiation by vaccination status is a practical way to open up some activities first while protecting those who are still vulnerable. MTF will visit this during our phase 2 heightened alert midpoint review, and Minister Lawrence Wong will speak more about that later. Let me address several other questions from members. Mr. Murali Pillay will be comforted to know the MOF actively monitors international developments in medical treatment options for COVID-19. This is done through the National Center of Infectious Diseases, NCID, and an expert committee. They have developed national treatment guidelines which are constantly updated based on new evidence. They provide guidance to our doctors on the use of evidence-based medical treatment options for COVID-19 patients. Our local institutions have also been participating actively in international multi-center trials investigating novel COVID-19 therapeutics. These trials have generated important data on new COVID-19 treatments, such as remdesivir. We will continue to closely monitor developments in COVID-19 treatments, proactively procure therapeutic agents which are shown to be effective, and maintain a stockpile based on our population needs. To Mr. Leon Pereira's question, factors that affect COVID-19 vaccine efficacy are an area of active study in Singapore. Persons who have contracted COVID-19 are clinically assessed for risk factors, and scientific papers on the correlations may be published in future. Antibody testing is not required after vaccination under Singapore's National Vaccination Programme, and we are actively reviewing the need for vaccine boosters. We are also continually reviewing Singapore's portfolio of COVID-19 vaccines. We plan to bring in non-mRNA vaccines that are robustly assessed for quality, safety, and effectiveness. This should happen before end of the year, subject to supply and regulatory approval. Testing, that will remain very important, even as we transit to living with COVID, because it is only through testing that we can know if we are infected and then do the civic-minded thing in excusing ourselves from work and then staying home. But we have to make testing simple, accessible, affordable, even more so than now, so that we can all do our part. I believe many members have done the breathalyzer testing just now, so it is one example of a test that is non-intrusive, simple, easy, accessible, and fast. Since mid-June, we have progressively rolled out regular, fast and easy tests for staff working in higher risk settings. These include a network of 16 quick test centers, which we intend to expand further. So in response to Ms. Joan Pereira's question, the quick test centers will support small businesses by allowing their staff to walk in and get themselves tested and have their results recorded. At some point, I believe the quick test centers should also be using breathalyzer tests, as we have gone through just now. We will also continue to work with NEA to deploy wastewater testing across Singapore. Mr. Dennis Tan asked about this. Currently, NEA has deployed 270 auto-samplers across 200 sites. So every site can have a few, 2 or more auto-samplers. We are increasing this to 500 auto-samplers across 400 sites by the end of the year. Wastewater testing is an increasingly strategic resource as we learn to live with COVID-19. Where we place the sites are very important. We can deploy them in areas where we suspect transmission is happening, such as around all the markets that are currently affected now, or we can deploy them to areas where we know many unvaccinated seniors are living there. Such testing is non-intrusive and would give us valuable early warning when COVID-19 starts to take hold in the locality. We'll know very early, and that will prompt us to take further public health measures in the affected residential areas. Mr. Darryl David, Dr. Lim Wee Kiak, and Mr. Murali Pillay asked about the safety of COVID-19 vaccines. MOH has been publishing monthly safety data updates on our website. It also gives an age breakdown of the affected persons, and indeed, the majority are young people. As of 30th June 2021, HSA has received 12 reports of myocarditis and pericarditis occurring in persons after receiving a dose of the mRNA-based COVID-19 vaccine. While there is a small increased risk among those in the younger age groups relative to the baseline rate, the local incidence rate remains low. One of the reported cases is a full-time national serviceman in the SAF who is below 30 years of age. None of the cases are from the Singapore Police Force or the SCDF. We implemented the Vaccine Injury Financial Assistance Program, or VFAP, to give greater peace of mind to people taking vaccinations. But remember, with or without vaccinations, there is a baseline number of disease cases amongst our population. Since the vast majority of Singaporeans have stepped forward to be vaccinated, there will naturally be numerous incidents which just happen to coincide with vaccinations. Hence, we have to do what is practical and reasonable, which is to have a VFAP, which is to have the VFAP applications reviewed by a panel of medical experts who will consider them against known evidence about the vaccines. A few members have also asked about the Sinovac vaccine. The Sinovac vaccine is called CoronaVac, but we always just call it Sinovac. Sinovac is the company. The vaccine is CoronaVac, but for simplicity, I'll just refer it as the Sinovac vaccine. As at 25th July 2021, about 72,000 persons have received at least one dose of the Sinovac vaccine, and about 17,000 persons have received their second doses. Amongst them, 28% are Singapore citizens, and they are mostly young. So for those who have taken the Sinovac vaccine and are seniors above 60 years old, only 10%, or in fact less than 10%, are Singaporeans. If the supply of 200,000 doses which the government has procured is insufficient to cater to the demand, private clinics can bring in additional supply, as is the case for any other WHO EUL vaccine under the special access route. As of 9 July 2021, HSA has received 10 adverse event reports following vaccination with the Sinovac vaccine. The event comprises mainly allergic reactions such as itch and rashes. As for concessions on safe management measures, the data on the efficacy of the Sinovac vaccine against the Delta variant is still building up. Sinovac has also recently submitted the required safety data for their application for the pandemic special access route approval to HSA. So the HSA and our expert committee are going through the various data. When the evidence justifies it, we will certainly want to extend the concessions to individuals who have received the Sinovac or other vaccines which may qualify. Mr. Deputy Speaker, sir, let me conclude. As a government, we need to recognize that our society is diverse, with different segments of the population having different opinions, needs, and wants. When these differences cannot be reconciled, we agree to disagree, we live and let live. At the same time, we do our best to unite and forge a consensus for what is a society without commonalities and without shared commonalities. And this is what a responsible government needs to do across a range of issues, from education, healthcare, public housing to racial harmony and free trade. We must always try to strike a balance between forging a consensus as well as respecting diverse views. It is the same when it comes to learning to live with COVID-19. On the one hand, we have the young, vaccinated individuals who feel that we should open up and allow vaccinated individuals to enjoy more social activities. On the other hand, we still have a sizable segment of older Singaporeans who, for medical or other reasons, are yet to be vaccinated and who remain vulnerable. Differentiated safe management measures is something we will have to put in place for public health reasons and to protect the unvaccinated. But at the same time, we must do our best to get more of the vulnerable vaccinated just now. As I reported just now, we are making progress. As for the non-vulnerable, as more of you get vaccinated, when you show more consideration to others, you are also doing your part to better protect the vulnerable. Remember our children, our nieces and nephews, younger brothers and sisters, under 12, will not be vaccinated for a while yet. So when we work together as a people, we will bring ourselves to a much stronger and more resilient position, and our transition to living with COVID will gather pace. Mr. Deputy Speaker, sir, Singapore is one of the few countries to have come through the last 20 months of the pandemic with very few fatalities. And we can look forward with confidence to living with endemic COVID-19 because a high proportion of our population will be fully vaccinated. Most of the developing world still has little access to vaccines. And even amongst the countries and regions which have vaccines, Singapore is unique. Because we have one group, including US, UK, Israel, many EU countries, which went through major episodes of widespread transmission, hospitals overwhelmed with many fatalities. They are now highly vaccinated and opening up their economies and societies. And then there's another group, the likes of Australia, New Zealand, Hong Kong, maybe South Korea, who kept the pandemic under control, but are now finding it a challenge to get their people vaccinated, partly because their lives have not been very threatened by COVID-19. And this will make us perhaps the only country in the world which has not suffered a collapse of our hospitals, nor a high death toll, and at the same time achieve a very high vaccination rate in our population. And this uniqueness is due to the unity of our people, the trust amongst them, and between people and government. Mr. Deputy Speaker, sir, we can look towards the road ahead with confidence and optimism. Thank you.